I think it's time that we had a talk. When Obama's healthcare plan, or parts of Obama's healthcare plan, went into effect, there's been a huge uproar. Love it or hate it, it's happened. There are a lot of advantages to it. There are also a lot of disadvantages to it. There are kinks. Those kinks need to be worked out and hopefully will be worked out. And that's part of government policy. It's a start. It's something. But what completely baffles me about this entire argument is that it actually has nothing to do with healthcare. This time last year, the Republicans were screaming and rambling on about how they also felt that healthcare needed to be done and reform needed to be made as long as it was their reform. And that's the impression that I'm getting now, is that this entire argument, this entire debate has absolutely nothing to do with actual healthcare and healthcare reform. It has to do with politics and the fact that there are certain individuals within the government who, instead of becoming a loyal opposition to challenge and allow the president to grow, they are becoming just a no. Just no party. That seems to be what's happening. And it has nothing to do with, again, it has nothing to do with the actual reform. It has everything to do with the man who made it and with his politics. And one thing that I keep hearing over and over again is that, it's Obama's socialism. It's socialism, and America isn't a socialist nation. Well, guess what? You're right. America is not a socialist nation. America also is not a democracy. America is a republic. In order to make any kind of large form of government, such as republic, function, you need a large and diverse group of policies. It can't all be one kind. So let's look at socialism. According to Webster's dictionary, socialism is a social system in which the means of producing and distributing goods are owned collectively and political power is exercised by the whole community. Okay, given that, saying that the healthcare reform is socialist, and you're against socialism, so you're therefore against the healthcare reform, that pretty much also means that you are against public schools. Public schools are technically a socialist institution. It is money from the government, whether it be state government or federal government. It is monies used by the government to support a public institution to which the public does not directly pay into, but everybody benefits from. All your children are able to go to a public school. That's why they're called a public school. Teachers are paid to teach everyone. Welfare, I know that's not a popular one, but welfare is a socialist program. Food stamps are a socialist program. WIC is a socialist program. These are things that are set up by the government, use government funds, whether they be state or federal, to support the public. Eisenhower's interstate project. Everybody uses interstates. Everybody relies on interstates. Whether it be for commerce or travel, you rely on the interstate system. Eisenhower's interstate system, and Eisenhower was a Republican, let's remember that, that is also considered a socialist program. Because again, government funds for a public effort. Everybody uses them. Everybody is able to, and everybody can, and everybody is encouraged to take advantage of that. These are things that are already in existence, that are taken full advantage of by a large part of the population and work. They could work better. Everything can always work better. Everything can always be improved on. Everything can always be kind of looked at and reevaluated, which is what's going to happen with the healthcare plan. It's going to be looked at, it's going to be reevaluated, and I seriously doubt that individuals within Congress are going to scrap it entirely this time 4 or 5 years from now, because by then it'll have been integrated. People will find out that there are good points to it, that there are also bad points, but that's when it'll be reevaluated. It'll be looked at again, and it'll be seen, okay, maybe we need to change A, B, and C. That's happening right now with the education system, the whole No Child Left Behind reforms. You need to have a diverse and wide varieties of policies in a government for that government to be effective.